morning. My name is Erika Chavez, and I am a sales coordinator at the SmithLife Homecare. Welcome to the Ask the Expert series. For those of you who don't know, SmithLife Homecare, we are a sister company with Charles C. Smith Life Communities, another trusted brand for elder care with over 110 years of serving the community. We operate in the Washington, D.C. and Montgomery County area. The SmithLife Homecare as the Expert Series focuses on providing valuable information and resources to our community while helping them to age in place. So today, I'm here with our honored guest, Dr. Seth Dubin from District Mobile Dental, an in-home concierge oral healthcare provider focused on helping older adults in D.C., Maryland, and Virginia. We are excited today to discuss the many services that District Mobile Dental offers for our older adults. Welcome, Dr. Dubin. Thank you for being today with us and giving us the opportunity to learn more about you and your work.
Good afternoon, Erica. It's very nice to meet you. I'm very, very happy to be here, and I'm happy to talk to you about all of our services and what we can provide the community.
Wonderful. Dr. Dubin, can you please tell us a little bit about yourself?
Absolutely. So I am a graduate of the University of Pennsylvania School of Dental Medicine. After my dental school training, I did a residency at the Veterans Hospital of Hudson Valley Healthcare in New York. This was a general practice residency. After that was finished, I completed another residency at the University of Pennsylvania that certifies me as a disabilities dentistry clinician expert. And then I took it even one step further because I love this community so much and I really like giving back to our elderly patients. I am also certified as a dementia practitioner. More specifically, in my role as Chief Dental Officer at District Mobile Dental, I am responsible for overseeing all patient care and treatment recommendations. And I think that's one of the really, really nice things about District Mobile Dental that may be a little different from some of our other competitors, if you will, is that because we are a small family-run business, I'm the sole practitioner doing all of this work. So it's not like a lot of other services where you'll see a different dentist coming out to you every single time. I'm the guy that you're going to see every single time. And I think a lot of families really appreciate that continuity of care.
Yes, I think it's awesome that you have your professional credentials, but also you have certifications and knowledge about working with patients with disabilities and dementia. So, Doctor,
there's no way that anybody should walk into a room with patients with disabilities without extra training, because it's just not the same, and you can end up creating unsafe situations when you do that. So that's why it's very, very important to have the extra training.
Wonderful. What is District Mobile Dental and what makes your company unique?
So District Mobile Dental is a mobile dentistry practice. It was founded about 10 years ago by my father, Jerry Dubin. He is a dentist as well. What happened basically was that my grandfather was having difficulties with dementia and having difficulties getting out to see doctors otherwise. My father kind of was looking around like, this is crazy. Why is there nobody providing a service for these people? He was then going into my grandfather's apartment, doing all of the treatment there without really having the proper equipment or otherwise. And then he decided that he was going to kind of grow a business from this. Basically, he had specific equipment manufactured for our business. One of the main things that I think we like to highlight that makes us a little different again from our competitors is that we are not a van. So there's nobody that comes out to our van. We bring everything right to the patient. And I think that that's extremely important because if you know a lot about dementia or Alzheimer's related patients, one of the most difficult things for them is having treatment and other procedures done in a setting that is comfortable, that they're familiar with, because taking them to a hospital or taking them to a doctor's office is completely unfamiliar to them, even if they've been there last week or 2 weeks ago or 5 times, whatever it may be. It can be unsettling to them. So when they're able to have the treatment done in their own rooms, even in the comfort of their own chair or bed, it goes much, much, much smoother. And I think that's one of the other really nice features about our company specifically that's kind of a little different from others.
I honestly believe the best business ideas come from a personal situation. It is amazing to hear that from a very difficult moment with your grandfather, a new business emerged with the specific mission of helping others with the same condition that he had. So what is your service area, and do you accept insurance?
So District Mobile Dental currently services the Maryland, Virginia, and District of Columbia. We are licensed in all 3 states. We currently do not participate with any insurances, but Jacqueline, who runs our front office, he is very, very, very diligent about working with families and getting reimbursed through our insurance companies. Very successful at doing so.
It is good to hear that you have dedicated staff willing to help the patients in this way.
Mm-hmm.
So what?
All of that stuff.
Go ahead.
As far as oral surgeons that we need and things like that, she's very good with referrals, all that stuff. She's wonderful with the front desk. So
wonderful. Good for Jacqueline. So what are the advantages of using a mobile dental provider?
So I think the main thing, like I was kind of highlighting before, being able to be seen in the privacy of your own home, especially for dementia patients, is really, really important. They're able to relax. They're more accepting of treatments, and it's less disruptive to their normal daily routine when they're able to be treated in their home. It also alleviates the need for family members to take time off of work. It creates less stress for their daily life when they don't have to be the ones worrying about taking their family member over to the doctor. And it just takes less time for them that way. So I think those are the main advantages to using a mobile provider, is that we are bringing the service to the patient. And a lot of times, I think it's very, very stressful for the family who's involved in doing the transportation, more so than even the patient. It's less stressful for them to just be able to know that someone's coming to them and they don't have to get mom or dad out of bed, into a wheelchair, and over into the car.
Yes, I remember being a child and hating going to the dentist. I cannot imagine how an older adult would feel going to a dentist's office, especially if they have more health issues. This is a really important at-home service.
Mm-hmm. That's absolutely true.
Can you tell us about the services that you provide, the specific services?
So we can provide a full range of services just like you would see at a normal dental office. The best way I can explain it, and the way I tell most of my patients, is the best explanation is it's like going to the dental office. It's just you're sitting down in your chair and I'm setting the dental office up around you. Okay. But we can do anything that you want, crowns, bridges, all that kind of restorative work, fillings, exams, cleanings, all the kind of normal work that you would see in a regular office. Dentures obviously being a very big procedure for us, given that most or a lot of elderly patients typically are losing teeth and things like that. But typically what we do is we start with a comprehensive exam where we take some x-rays, we do a cleaning at that time, and then any additional work that would need to be done, we have a discussion with both the patient and their families after the initial exam. We work through that full treatment plan, what the families think is a good idea, what may be too much for that patient, and then we work from there as far as how we're going to get that work done.
I am honestly impressed that you can perform all treatments that any dentist office can provide. That is great to hear.
We work very, very closely with the families, as far as what they think that the patient can, tolerate, how they're willing to tolerate it. If we need to take extra visits, we will. If we need to make shorter visits to get things done, we will. So we understand that it may not be exactly as you would see it done in the dental office per se. We may have to make some adjustments based on the patient, but we try and get everything done that we possibly can.
Wonderful, but what about dental emergencies?
We see dental emergencies as soon as possible, typically within 24 hours, if not 48 hours, okay? The only reason why we wouldn't be seeing in that span is if something emergent is coming on our end, okay? But typically always within 24 to 48 hours, we're seeing dental emergencies, even if the facility is not something that we've already seen before or otherwise.
Okay, so do you have any kind of Zoom consultations?
As
or
far
everything's in person?
Zoom consultations?
Yes, Zoom consultations. When it's an emergency.
So
because how can you determine that it's an emergency at the time?
Typically, Jackie's pretty good as far as receiving those phone calls, determining which emergency needs to be seen that day or the day after. But yes, we are always willing to have a Zoom phone call. The only difficulty sometimes with Zoom phone calls and the elderly population is technology can be a little bit more difficult. So if a family member is available, that always helps us far as the Zoom calls, pictures, and otherwise. But any of that stuff is always wonderful because if we can save their time and our time being wasted, why not? But if we can do a Zoom call or take a picture and just text that to me, anything that will help to try and get the right diagnosis, that's really what we're after at the end of the day.
Wonderful. This takes me to my next question. How
Sure.
often should older adults be seen for dental care to try to avoid these emergencies?
So this is one of those funny things that I always joke around with my patients about, which is that the reason that you go to your dentist every 6 months is because that's what insurance decided they were going to pay for. But the truth of the matter is that everybody is very different. Some regular adults need a cleaning every 3 months. Some need every 4 months. Some need every 6 months. Some could go a year because they're just that good about cleaning. When it comes to the geriatric population, I really recommend every 3 months. Okay. And that is more so because their ability to clean, their dexterity is just not once what it was at 30, 40 years old. And I think at 3 months, you're starting to notice a decent amount of buildup around their teeth that can lead to more substantial problems, cavities, crowns, extractions, and otherwise. Preventative care is always the best measure, whether they're young, old, or otherwise. So if we can do as much preventative care as possible with these patients on a 3-month basis, that's really what I would like to do.
That is fantastic. Now you're making me think about my parents. They are 87 years old and living in Colombia. By any chance, are you planning to expand your services to South America?
I'll have my sister-in-law, my brother just got married to a Colombian woman about 1.5 years ago. So I will have to discuss expanding to Colombia.
Wonderful. This is something that we have in common. To be honest, I just wish we could have something similar back in my country. Unfortunately.
The crazy part about it is even in the United States, we're located in a major metropolitan area, and that's why this service exists right now. There are a lot of underserved communities, not just geriatric, but regular old teenagers, adults, and otherwise that are not getting the care that they need for. So I'm very happy that this service is being provided here, but it's needed everywhere. And that is definitely something one day we would like to try and do. But right now, we like the fact that it's a small family business that we can kind of have our hands on and provide the care that really is what's needed.
Dr. Dubin, I love your energy. So now, please tell us about how your potential clients, customers can find you.
So they can go to districtmobile.com to find us, okay, if they need to. If they don't like using the internet or they would rather have a phone call, they can reach Jacqueline directly at 240-485-8688. Again, that is 240-485-8688. And the point of contact that you will reach out to is Jacqueline. As I said before, she's wonderful. She will help you with all of your needs, setting up the appointment, getting through the forms, and everything else that is necessary, okay? If for whatever reason she doesn't pick up, please leave a voicemail. She always returns those phone calls within about 24 hours. And the last place that I would recommend, if you can't get either the website or through the phone call, we do have a Facebook page that's set up that's District Mobile Dental as well. You can reach out to us on the Facebook page as well.
Good. I am really impressed by the services you provide. To be honest, this is the first time that I hear this type of services, and I'm sure our viewers feel the same. So before ending this interview, I would like to mention we will display more information about Dr. Seth Dubin and District Mobile Dental and how to get in touch with him and his team. Thanks again for listening to us today. Thank you, Dr. Dubin, for taking time from your busy schedule and allowing us to learn more about the face behind District Mobile Dental. As Kathleen, my manager, says, stay tuned for our next chapter on the Ask the Expert series. Bye for now.
Thank you, Erika. Have a nice rest of the day, all right?
You as well. Thank you.